In today's Health Watch, for many people, talking to your doctor can be intimidating. A recent study found, it's kind of a romantic song to be playing with. It's not really a doctor song, but we'll take it. Study found that trust in physicians and hospitals fell to 40% since the start of the pandemic. That is a big decline. That trust begins in the exam room and knowing how to have difficult conversations with your doctor. For CBS Sunday Morning, Dr. Jon LaPook showed how important the tone of voice is when you approach any tough discussion.
Babies and toddlers react in predictable ways to both the tone of someone's voice.
Did you have a good night's sleep?
And the expression on their face.
When you woke up, it was your birthday party.
Children learn to trust certain voices, even before they can understand the meaning of words. And chances are, an angry, loud voice will elicit fear and the very opposite of trust. Those deeply ingrained responses follow us through life and can help or hinder our interactions with others. If we really want to have conversations instead of dueling monologues, we need to be genuinely curious about what the other person has to say. And if the way we communicate, not just the words, but the way we say them, triggers mistrust, there's little hope for a meaningful exchange of ideas. Let's be clear. A mean thing said nicely is still mean. And there are times when a warm and compassionate tone will do you little good. For instance, arguments with people who disregard facts. But for all those other times, consider taking a lesson from children. The next time you strike up a conversation with somebody who has an opposing view, try using a kind and gentle tone. It will signal that you are genuinely interested in hearing what they have to say. You might not reach a meeting of the minds, but look at the face. Instead of a scowl, you just may see a smile.
Oh, that was... So while this was playing, I'm not going to introduce you. Dr. Jon LaPook is here.
Ta-da.
And while this was playing, you told us those were your kids in those videos.
Daniel and Noah, now 32 and 28.
Oh my gosh, wow, VHS.
Yeah. Exactly.
So tone of voice makes a huge difference. I mean, this is everything.
It's huge, right? And every parent knows that, right? It's how you say it. They're not understanding what you're saying, but good morning. How are you? And it extends, of course, throughout our entire lives, and certainly in the doctor's office. You know, if you go into a doctor's office, you have not only tone of voice, but you have tone of the whole conversation. You walk in, and the doctor does this. I'm just checking out some Yankee tickets here.
Yeah.
You've already established the wrong tone.
Are doctors trained on how to talk to patients?
Well, that's what we're doing. So we started something called the Empathy Project at NYU Langone Health, where I am a professor of medicine. And we use Hollywood quality short films and other materials to teach clinicians in training and others to be more empathetic and sensitive and competent and have the right tone of voice and listen, and to empower patients to demand that. And it's 10 years later, we have 10 films. We're teaching everybody from first year all the way up to attendings.
So there's real research on this? What does it show?
Well, it turns out that your actual level of care, if you have empathetic relationship, for example, and good communication, you do better medically. So your diabetes is better controlled, your hypertension is better controlled. It makes sense, right?
Yeah.
I mean, there's a relationship there that's important. And you know, not every relationship works, right? So if you're in that office and you're just not feeling it, you guys are both happily married. Did you marry the first person you dated?
No.
Okay. So you may not you may not stay with the first healthcare professional.
But in marriage, you will have conversations sometimes not about what was said or done, but about the tone of your voice.
Yeah.
I just didn't like the tone.
I don't like your tone right now. I don't like the way you're saying that.
Yeah. And
check
people
the tone.
Check the tone at the door. But people are often, these days, right, a lot of people are just coiled and ready to strike.
Right.
Yeah.
And you have to be uncoiled and ready
So what
to
people
listen.
should just take a beat, think about the tone,
I think
deliver
take a beat, be empathetic and understand, like, how am I coming off?
Yes.
And there's no way, like, if you're one-on-one with somebody in a room and you start off at the top of your lungs, that's just not going to lead to any place good.
And the true definition of empathy, think about where that other person's coming from, and that will impact your tone. Dr. Jon LaPook, always helping us.
Always great.
In the exam room, in our marriages, in all the ways. Thank you so much.